Hello there, welcome to my show, COVID-19 update by Heerak for November 18, 2020. It is Wednesday and it is National Princess Day. Yeah, so who's your favorite princess? As you know, I've dated some princesses, some royalty. So you know, when I was at Cambridge University, I lived in England for about 5 years. My best friend was royalty, or I ate dinner with royalty from the country of Georgia in former USSR, Germany, Prince of Freiburg, and the royalty from Scotland, um, and the royalty from Macedonia. As you know, Prince Philip of England, who's married to Queen Elizabeth, is from Macedonia, royalty from Macedonia. Yeah, so those are my friends, and I got to date some royalty and nobility women. Very polished, very nice. Um, yeah, I love princesses. So you're listening to some Arabic music in the background because we're doing top five COVID-19 cases in the Middle East. So number one is Iran. Iran is actually kind of Persia. It's not an Arabic country, it's a Persian country. Um, 801,894 cases, 42,941 deaths. So the death rate is 5%. So the number of deaths in Iran kind of matches number of deaths in European countries right now. So situation is pretty serious in Iran in terms of COVID-19 deaths, at least by the standards of the Middle East. It's number one. Iraq is number two. And as you can see, you have 526,852 cases. And 11,795 people have died, so 2% death rate. Um, Saudi Arabia is number three with 354,208 cases, and its death rate is rising. It's now at 2%. It was at 1%, and a couple months ago it was at under 1%. So that percentage is rising in Saudi Arabia. So Saudi Arabia should worry because it may soon become 42,000 or more because death rate is rising very fast in Saudi Arabia. So you have 5,710 deaths so far in Saudi Arabia. Number four is Israel. Its death rate is rising too, but not as fast as in Saudi Arabia. 326,331 people have been infected, and the death rate is right now at 0.8%. So about 2,739 people have died. So in several weeks, their increase is like death increase is like 100%, but or close to 100%. But still, the numbers are relatively small. But the fact that the death numbers are growing close to 100% in such a short period of time, um, and Israel shut down in Rosh Hashanah, the Jewish New Year. So even though they shut down, the deaths are increasing. So Israel should worry because it was the first country in the world to completely shut down before the Jewish holidays. But still, the death rate is increasing. Cases are increasing. Even if America shuts down completely now, we're going to have a lot of deaths because there are so many people already infected. and family members can infect each other too, and so even with complete shutdown, you're going to have cases spreading and people dying. Obviously, going to reduce the number, but the death can come. Um, yeah, so Israel has 326,331 cases, 2,739 deaths. Israel may, its death rate may go out of control. We don't know. We have to observe it. But it's a small nation, but it's very crowded. It's like New York. Everywhere you go to Israel, it's kind of like really crowded like New York. So that's why it's very dangerous in Israel. It has the possibility of massive death. I mean, you could see 1/3 of Israel's population die if Israel is not careful, because it could spread like wildfire. Um, so yeah, if you're in Israel, you should worry because everybody lives so close together. United Arab Emirates, uh, death rate is 0.4%. And they're number 5 in Middle East. 154,101 cases, 542 people have died so far. That's like 1/3 of the people who died today in the last 24 hours in the United States of America. So most of the Arab countries, they have very few people dying from COVID, especially in Arab countries because the houses are kind of widespread. They don't have too many apartment buildings. Um, like in Israel, they have a lot of apartment buildings. Um, so a lot of Arab countries they don't have that many deaths. Like if you go to Palestinian areas, they don't have that many apartment buildings. They're all single homes in the West Bank or in Gaza. So obviously, COVID-19 is not going to spread as aggressively when there are single homes. Uh, but in apartments, hallways are narrow. People can get it just walking by each other. And so that's why COVID-19 spreads much more fast in cities with a lot of apartment buildings where you cannot be apart 6 feet from each other when you're walking just, from the building and out the building, so elevators can be a place where you can catch COVID so if you have somebody who has COVID, and who's coughing and sneezing away inside that little elevator, people can get COVID. Yeah, so there are a lot of dangers that are coming in this winter, well, that we are entering right now. So many people can die in the United States. I'm predicting that minimum 3 million Americans will die before June 2021, but I think it'll be closer to 30 million Americans. So 30 million Americans will probably die by June 2021. You gotta remember, we have five times 10, 50 states. You cannot keep up with all 50 states all the time. So you don't always know what's going on in other states. You may not even know what's going on in West Virginia, and we are in Virginia. West Virginia is right next to us. You may not know what's going on in Maryland. And Maryland is just, you know, um, next to us. And as you may have read in the news today, Governor Larry Hogan passed the executive order, or is issued an executive order saying that nobody is allowed to visit any patients in Maryland hospitals in the whole state. So that is to prevent COVID-19 because hospitals in Maryland are beginning to fill up with COVID-19 patients. So there's, so COVID-19 patients are in hospitals, which means visitors can get it if they're not properly wearing their mask. They may be wearing their mask, but they may not be properly wearing their mask, in which case you're vulnerable to COVID-19. And also, you don't know which visitors have COVID or not, right? Because they could be asymptomatic, but they could still give COVID to people. So the fear is, the nurses and doctors will get COVID-19 from the visitors. So Governor Larry Hogan is trying to protect the nurses and doctors from getting COVID-19 from like strangers, because visitors are strangers. So there's a rationale to what Governor Larry Hogan is doing, because obviously when you have nurses dying from COVID-19, that's going to spike up COVID-19 death in your town, in your city. So if you have 10 nurses who die in Baltimore, that those 10 nurses dying from COVID is not just 10 nurses dying. Each nurse can have 5 patients. So there are 50 patients every day who could die because of the lack of nurses. Um, so that's in a week, you could have 50 patients dying per day because there are 10 nurses dead and they can't go into work. So in 3 days, you could have 150 people die because those three, you know, the 10 nurses cannot take care of 5 patients each, which would be 50 patients. That will end up with 150 patients whose health becomes compromised, and then they die. And so let's think of it statewide in Maryland. You have, let's say 50 nurses dying from COVID-19. Um, that's, or let's say 100 nurses died from COVID-19. That could be 1,500 people, 10 times, that could die in 3 day period because of these nurses who are dead in Maryland, all over. So, it's a rough estimation, but you can replace nurses overnight. Um, what sets apart registered nurses is that they are able to do assessment, and they're able to track and monitor the patients as experts. That's what they're trained to do. And that sets them apart from others who are not trained to do that. And so that's why nurses are crucial or critical to keeping down the death rate of the patients in the hospital. Because doctors don't stay with the patients for like 12 hours, right? They come in maybe once a day or twice a day for a few minutes, five minutes or so. And so, it's the nurses who are taking care of the patients. So I can understand the rationale if that is the most important thing for Governor Larry Hogan, why he's trying to protect nurses um, and doctors and others who are working in the hospital from getting COVID-19. Because obviously you have to protect your quarterback, or you have to protect your soldiers, right? I mean, that's why you have armored vehicles. If you cannot protect the frontline workers like nurses, then the whole conflict or the war is lost against COVID-19. So we have 50 states. One of the challenges that we're going to see in the next month or two, because we have about 6 months of COVID-19 left, but we're going to see the distinction between different states in terms of how many people die based on how well they manage their nurses, how well they protect their nurses, how well they keep the numbers of nurses up in their hospital. So right now, you don't see so much discrepancy, but I would say about a month later, you're going to see a sharp difference between states that manage their nurses well and protect their nurses from COVID-19 death, prevent nurses from leaving to another state or whatever, and states that lose nurses to COVID-19 death or lose nurses who go to another state to work or whatever. So Larry Hogan may be making a smart decision in trying to protect COVID-19 from injuring or infecting or killing nurses and hospital staff. So it seems for some people to be a little bit extreme, but we have 6 months of COVID-19 left. So we will tell whether Governor Northam's decision is a wise one. I mean, you can't go wrong, by being careful, right? There's no way you're going to go wrong by being more careful than not being more careful. So Governor Northam's extreme caution or care that he's taking to protect the nurses and doctors in hospitals, and also visitors, because visitors can get COVID from COVID patients that they may not know of, who may be, um, because COVID can stay in objects for what, 3 days, 3 to 5 days. So if somebody with COVID sneezes onto a hand railing and you touch that and you touch your eye with it, you get COVID, according to the experts in Centers for Disease Control and World Health Organization. So visitors could accidentally touch like a handrail with COVID and put it in their eye and get COVID too. So it's not just about protecting the nurses and doctors. Obviously, Larry Hogan is trying to protect the visitors, because when visitors come, you don't know which visitor took off their mask to sneeze inside an elevator, right? You don't know. You just don't know. And then anybody who touches a elevator button where somebody sneezed on, and if they don't wash their hands and they put their hand to their eye, they could get COVID, right? According to what Center for Disease Control and World Health Organization are saying about how COVID-19 can be transmitted. And so, Larry Hogan is taking extreme caution to protect the lives of obviously nurses and doctors who are critical to keeping the death rate down, especially because patients need them, but also visitors who come, they could infect each other without people knowing, right? I mean, how are you going to make sure that people are not sneezing with their mask on when they're inside an elevator or in a hallway, right? They may take off their mask just to sneeze. You don't know. So obviously you're supposed to sneeze into your mask, but not everybody's going to do that, especially visitors. Um, so in a sense, Governor Larry Hogan's decision to prevent any visitors in hospitals uh, may turn out to be the best decision made by a governor in the United States. Let's see, because we have states we can compare, right? We can compare what happens in Maryland hospitals with what happens in Virginia hospitals and what happens in Washington, D.C. hospitals, what we call DMV zone. DMV stands for Washington, D.C., D.C., D, and Maryland, V, Virginia, DMV zone. So if Governor Larry Hogan, who so far is the only one who is preventing visitors to all the hospitals in Maryland, if Maryland death rate stays lower in terms of percentage wise than Virginia and DC, then obviously his decision is shown to be why Maryland's nurses don't die as much, Maryland's doctors don't die as much from COVID, Maryland's hospital visitors don't get COVID as much. You see, I mean, you cannot keep track of all the hospital visitors, whether they get COVID or not, right? That's just impossible to do because we're not God. Only God sees everything, knows everything. We're human beings. We have to actually track things. We can't track every visitor and see, like if 100 visitors came to a hospital, we cannot track how many out of 100 got infected. We just don't know. Nobody's doing that kind of tracking right now. So Governor Larry Hogan of Maryland, who's Republican, actually is making a very smart decision because you have to protect your soldiers, right? If your soldiers die, then you can't win the war, right? So Governor Larry Hogan's decision is actually very wise, and this is why I like Republican governors, because I think they're smarter than Democratic governors in terms of making decisions that actually make an impact in the long run, right? I'm not talking about like frivolous decisions like, oh, wear a mask everywhere, even outside. That's like a frivolous decision that doesn't really have the greatest impact on life and death. But the kind of decision that Larry Hogan made, which is like no visitors in a hospital, that actually protects the lives of nurses day to day, doctors day to day, hospital staff day to day, and also the visitors day to day. But obviously, most important are like protecting the lives of nurses and doctors, because without them, your state's death rate can climb up 10%, 20%, 30%. And you can't just get nurses from other states because every state is suffering from shortage right now, and that's going to get worse and worse and worse and worse and worse and worse and worse. And we have 6 months left. So we're now in November, December, January, February, March, April, May, more than 6 months, June possibly. So we have like 6 to 8 months left. Death rates begin to spike up. Hospitalization is spiking up, and it's like overfilling the hospitals. So what Larry Hogan, the governor of Maryland, is doing, maybe the smartest decision by a governor ever made so far in the United States, because you have to protect the nurses. If nurses die, people die. You know that, I think that has to be like drilled in. It's like, if you have Marines dying from dysentery, then you probably will lose the war. We need the Marines to go. I mean, they may die fighting the war, but you want them to die in the battlefield, not by dysentery, eating rotten food in the canteen. You know what I'm saying? So yeah, nurses will get COVID even if there are no visitors. But the idea is some of the nurses will get infected and die from COVID while treating patients, but you want to keep the rate of death of nurses low. Um, so yeah, Governor Larry Hogan, it makes right decisions, I would argue. I know it's a little bit extreme because obviously visitors want to see their relatives. I like I support patients seeing their visitors. I think it's a good thing, but not when there's COVID. And if the visitor has COVID, we just don't know, right? Every visitor is not tested for COVID. They may have their temperature checked, but if they took Tylenol, their temperature may not be that high, you know? And they may be asymptomatic, but they could still infect people. What Governor Larry Hogan is doing makes a lot of sense, you know? So yeah, well, let's see. 1 month from now, if we see like tremendous disparity between the number of nurses that die in Virginia compared to a number of nurses who don't die in Maryland, then we can say, well, Ralph Northam, the Democratic governor, didn't really make the decisions that were needed to save the lives of the frontline workers. Whereas Maryland's Republican governor made the right decisions to save the lives of frontline workers. You see what I'm saying? So let's see, if Larry Hogan, Maryland governor, decision is exonerated, but his decision is based on sound rationale. Um, yeah, so let's see. Right now, we have about 1,000 Americans dying every day right now. So that's up 50% because about 1,000 people were dying, before Halloween. As I said, I said all the governors, mayors, Arlington County Board, Fairfax County Board, Alexandria City Council, Falls Church City Council. I said, and I just constantly encourage them to ban Halloween parties and trick or treating, but they didn't do it. So the cases have gone up like 100%, and the deaths are going up 50% right now. Because death come a little bit slower than the cases, right? So I would argue that I'm proven right in calling for every governor and every mayor to ban Halloween and trick or treating. But I don't know any mayor or governor who has taken my call very seriously. And that's the problem, right? I'm the Leonardo da Vinci of 21st century. I'm Heerak Christian Kim, candidate for U.S. Congress in Virginia's 8th District. That includes Arlington, Alexandria, Falls Church, and Fairfax County for November 8, 2022, 2 years from now, what I call 2 years of COVID campaigning, right? Because we're going to have COVID 365 days a year continuously from now until November 8, 2022, with people dying every day, probably average of anywhere from 1,000 to several thousand dying every day from now to November 8th, because sometimes they'll have lower deaths, but the average will stay above 1,000 most likely. Um, and so, and I have a lot of expertise. So I'm trying to save lives here, but, governors and mayors need to listen, because only 2 weeks ago, basically only about 2 weeks ago, there were only like 1,000 deaths per day or lower. But now we have 1,500 deaths per day. So now we've increased 50%. That's a lot. And it may go up to 2,000 deaths per day by next week, or even higher than that, because death rates are climbing now right now. So it's a serious problem. Um, I have happy memories. As you know, I'm sharing the bachelorettes from my my bachelor in Poland uh, enterprise. I actually dated over 15 women in Poland when I went for a conference at the European Association for Biblical Studies to deliver a paper on Jewish studies. And I'm an expert of Jewish studies, so I'm a card-carrying member of these Jewish studies associations around the world, where top experts and scholars and professors are members. So I get invited to present my research, latest cutting-edge research. So I did that at the University of Warsaw, which is the Harvard of Poland, in 2019. So while I was in Poland, you know, uh, I'm single. I've never been married. I haven't had any children. So I took that opportunity to date some women, which was good, And so I've been introducing in the last couple of shows some of the women that I have dated, bachelorettes. So today I'm going to introduce you to another bachelorette. Yesterday I introduced you to Caroline. Today is Olivia. So I met her near the Ord bus station in Poland, in Warsaw, because I was planning to go to Gdansk, for some fun. Uh, it's a fun city. That's like the tourist spot for Polish people. So I went to check out, buses, if there are buses going to Gdansk. I ended up taking a train there. So I went to the Warsaw bus station, and it's near the Hard Rock Cafe in Poland, in Warsaw. So you see me photo in front of Hard Rock Cafe, Warsaw. And I met Olivia, just like walking, and I saw this very attractive woman. Um, and so I started talking to her and got her phone number and asked her out on a date. So you see me on a date with Olivia there. Um, so she's a manager of a Greek uh, Greek market. So they sell Greek foods. In Poland, Greek foods are kind of popular, I guess, in Poland. So she's a manager, store manager of Greek foods. Um, so we had some interesting conversations. Very pretty, as you can see. Very pretty eyes, um, very pretty blue eyes. And there's a photo of me and Olivia in front of a Polish. I guess it's like a parliament or some kind of a government building. Um, yeah. So yeah, she's really pretty. I really like her, Olivia. So obviously, she made the cut. Hi, Olivia. So when I go back to Poland, unless she's already, she gets married before I go back, but she's single now. So her brother is a big shot Catholic priest in Poland. So she's a very devout Catholic woman. Her family is very devout Catholic family. And yeah, so yeah, so I'd love to see her again. When I go back to Poland. Obviously, I don't know if you've seen the game Bachelor, but generally, you have these women, and then you give the flowers, and then the last woman standing, the last when the one woman is left, that's the woman you want to continue romance with and possibly get married to. So yeah, so I mean, I have over 15 women. I have to reduce their numbers. So I'm just kind of introducing you to several bachelorettes in Poland. As you know, COVID-19 hit, and basically we can't even fly to Europe. Um, so obviously, Bachelor in Poland is in hiatus. It's like in a pause right now. But yeah, let's see. If I'm not married by the time COVID-19 is over, it'll probably continue on and on. Maybe it will never be over. I mean, I could always go to Poland and then continue. I guess. So let's see. But yeah, Bolivia is really nice. So we had Polish food at that restaurant. Really, really good Polish food. I like Polish food. Um, Yeah, so there are three articles today, and kind of continuing on in the theme from yesterday. My question that I'm asking today is COVID-19 USA, COVID-19 hell here already? That's the question. Obviously, Governor Larry Hogan of Maryland thinks that COVID-19 hell is already here. That's why he's passing a law to prevent any visitors from going to any of the hospitals in Maryland, like in Baltimore, Montgomery County, Howard County, Arundel County, all over Maryland. You cannot go to a hospital to visit your relative who's a patient there for whatever reason. Um, because hospitals are filling up and starting to overflow. As I said, I estimate that all the hospitals in Washington D.C. area will be completely filled in November. That includes where the hospital where I work, Virginia Hospital Center in Arlington County, and Unova Fairfax Hospital in uh, Falls Church area, and or Fairfax County, and then Unova Alexandria Hospital in Alexandria City, and then MedStar Georgetown Hospital, where Georgetown University is attached to that. MedStar Washington Hospital Center, which is more in downtown Washington D.C. area. Children's National Hospital, which is exclusively focusing on children. A lot of children are going to die. I'm predicting thousands of children will die in every state, including Washington, D.C. Thousands of children will die in Washington, D.C., unfortunately. Um, if you let children like get COVID, obviously, I work hard to try to encourage Washington, D.C. public schools to completely shut down. So it did. So we've kept the infections low among children so far. So maybe, thousands of children won't die, because as long as you don't have children getting infected, they're not going to die from COVID. So, if you're infected, you can die, right? That's the thing. I don't believe the liberal media, which seems to make it sound like COVID-19 isn't that serious. It's very serious. It's going to kill a lot of people. Um, yeah, and obviously, as you know, I worked very hard for 3 months to shut every public school in Virginia 8th District down. So Arlington County Public Schools, Alexandria City Public Schools, Fairfax County Public Schools, Falls Church City Public Schools. I worked hard to shut them down, and they all did not open in classes. They went open. They had 100% remote learning, online learning. Because I worked 3 months to shut these schools down to save your life, your children's life. So obviously you should be grateful and thankful for that because I worked hard for you. I marched for your life, right? I marched for your children's life. Um, the first article is New York City will close schools for in-person learning to curb COVID outbreak, Mayor de Blasio says. So the largest public school district, New York City Public Schools, is closing. When I went as a representative of American Federation of Teachers, AFT union, I'm a union leader from this area. I represented Local 6, which is Washington Teachers Union, a part of AFT, American Federation of Teachers local chapter. So I was voted in by my peers, other AFT members, union members in my union, Local 6, to represent them at the national convention that happens every 2 years. So it happened in 2018. That was the last physical meeting of AFT, and probably will be the only physical meeting for years to come, maybe even 10, 20 years to come, because COVID-19 may be forever. Um, and so, I went there representing, and so I met a lot of leaders of New York City Public Schools, union members. They came in large numbers from New York City because it's the biggest public school, and it's part of the American Federation of Teachers. So, so this article by Noah Higgins Dunn for today in CNBC, the significant quote from that is, the shuttering of the nation's largest school system had been anticipated for days after de Blasio told parents on Friday to have a plan in place in case the city decided to close schools for in-person learning. NBC News New York reported remote learning will begin Thursday, so that's tomorrow. Um, the mayor said in breaking the news over Twitter. Obviously, Twitter is a way to publish your ideas, so there's freedom of speech. You are fully protected on Twitter for your freedom of speech by U.S. national law, U.S. civil rights law, because we are not a communist dictatorship. Whatever you publish on Twitter, because it's a publication, you're completely protected by federal law and civil rights law, right? Nobody can fire you for what you publish on Twitter. Nobody can discriminate against you for what you publish on Twitter. There's freedom of speech. Just like, they can't fire you for what you say, uh, with, with people sharing your ideas, right? And so, there are communist type, socialist communists who want to like prevent you from sharing your own ideas, having your free thought, right? This communist dictatorship like China, former USSR, Cuba, Venezuela, they're all about controlling the citizens and what they say, what they think. So you're going to have like liberals like Joe Biden, Kamala Harris, Nancy Pelosi, like these liberal types in US government, we're going to try to control your thoughts and speech, right? Try to prevent you from having freedom of speech, freedom of thought. And so you can expect that because unfortunately, Democratic Party has become more communist, right? They don't respect people and they don't respect people's right to freedom of ideas, freedom of speech, freedom of publication, right? Because they have become more communist, socialist, Marxist. And, socialist socialism is all about controlling your thoughts, right? So if you read 1984 by George Orwell, you read about what a fictional writer's rendition of socialist state would look like in the future state, right? They try to control your thoughts, control what you say, right? And they try to get you fired or penalize you if you have different thoughts from the government. Like our government in Virginia is Democratic right now because you have Ralph Northam who's Democrat. So if you disagree with Ralph Northam or Democratic Party that's in control in Virginia, they'll try to get you fired. They'll try to get you arrested. So this is the kind of prediction that we see in George Orwell's like Animal Farm, which is a commentary on a socialist revolution, right? Or 1984, which is a prediction of what would happen if your country becomes socialist. So you should expect this to happen in Virginia because socialists, and unfortunately Democrats are becoming more like socialist, communist, Marxist, they have the propensity to control your thoughts. Thought police, groupthink. They want you to think like that. So they're going to penalize you, get you fired from your job, or arrest you if you don't agree with their liberal values, right? Socialist values. And so that's something that Virginians unfortunately may expect, right? Because Governor Northam is a Democrat and Democratic Party is kind of socialist. They want you to like say what they want you to say. If not, they're going to penalize you. So that's what's happening right now in America, unfortunately. This is why I think Joe Biden is the greatest danger to America, is he tries to control your thoughts, right? I mean, you can't have your own thoughts. And that's the problem with Joe Biden and Kamala Harris, because they're going to try to control your thoughts. Yeah, and your freedom of speech as well. And so, obviously, we don't want to become slaves of the government, being told what to think, what to believe, what to worship, right? Um, and so, we are like facing a situation here where, you know, Bible following Christians may be arrested because of the fact that Joe Biden is in power and he stands against the Holy Bible and the value system of the Holy Bible. So it's a really sad reality right now in America. And that's why I'm hoping that Joe Biden will not be inaugurated in January. Hopefully, we will have a recount, and the recount will show that Joe Biden did not win. So that's a hope that I have, because I think Joe Biden's America is America where Christians who believe in the Bible will be arrested, in large numbers, fired from their jobs in large numbers because they follow the Holy Bible. Because Joe Biden doesn't respect the Holy Bible. He's pro-abortion, he's pro-gay marriage, and these are all against the Holy Bible, right? So Joe Biden is going to try to use U.S. federal laws to arrest you if you're someone who follows the Holy Bible and what the Bible requires of you and society. So yeah, so that's a serious problem right now. But anyway, let's go back to the article here. Um, and so the mayor said in breaking the news on over Twitter, quote, "We're in the middle of something really tough right now," de Blasio said at a press briefing Monday. We have put health and safety first, and we must put health and safety first. And that is actually true. Because as I said, we're going to have 3 million to 30 million Americans die from COVID-19 by June 2021 at the current rate. You just have to do simple mathematical calculation that you use for compound interest or exponential growth, and you can see that 3 to 30 million people will die. So it's a mathematical fact, mathematical calculation at current projection, current rate of increase, you're going to have 3 to 30 million die. That's a mathematical calculation. So that's one information that you can use to calculate potential number of deaths. So let's read the second article. As U.S. reaches 250,000 deaths from COVID-19, a long winter is coming. And you know, this show, COVID-19 update by Heerak, started on April 2nd, 2020. And at that time, we only had 7,000 deaths. So from April, now, you know, April, May, June, July, August, September, October, now we're in November. In 7 months, we had basically 250,000 people die. Yeah, in 7 months. That's like half a year. So if you calculate that for a year, at that rate of death, we have 500,000 people dying in 1 year. But obviously, the growth is exponential. Because in April, you know, COVID-19 was concentrated in like only a few areas, right? Like New York, Detroit, you know, Chicago, you know, a few areas, Los Angeles. So now it's like everywhere. So obviously, it's not going to be the same rate. So it's going to be exponentially grow. So even at the same rate, you're going to have 500,000 people dying in 1 year. I am saying it's going to be much more than that, right? So think about it, next 6 months, all I'm saying when I say 3 million people are going to die is last 6 months, 7 months, we had 250,000 people die. Next 6 months, we're going to have 3 million or more die, right? That's only 12 times more than past 6 months. But for the past 6 months, COVID-19 was spreading everywhere in America. Now it is everywhere. So it makes logical sense that we're going to have 3 million to 30 million people die in the next 6 months, 6 to 7 months. You see what I'm saying? So even from a logical, rational assessment of demographics, so that's an area of geography, my estimation of 3 to 30 million COVID-19 deaths in the United States by June 2021 is logical, rational, and more possible than not. You see what I'm saying? This is why I am the Leonardo da Vinci of 21st century, because I use geography, demographics, which are part of history. And as you know, I've been trained as a professional historian at UCLA. I use social scientific methodologies, which are a form of scientific methodology, along with mathematical calculation, which I just talked about a few minutes ago, to predict what's going to happen, right? So there are several approaches, academic approaches or expert approaches you can use to evaluate and estimate what's going to happen in the next 6 months. And that's why I believe that I will be proven correct. And Dr. Fauci, Dr. Hahn of FDA director, Dr. Redfield of CDC director, they will all come to my position in the next few weeks. I've always been right. I've always been more right than Dr. Fauci. When he said don't wear a mask, I've always said wear a mask. Yeah, so I'm sure I'm going to be right again over anything that Dr. Fauci, Dr. Redfield, Dr. Hahn has said, because I've always been more right than they have been. In like 95% of the times. So let's read the article here. Um, the United States has surpassed yet another devastating milestone in the ongoing COVID-19 pandemic. 250,000 Americans have now died from the disease. It's a disease. It's going to spread person to person. And do you see why Maryland Governor Larry Hogan is saying no visitors in any of the hospitals in Maryland? Do you see why that's a rational decision by a leader of a state, right? Uh, that's more than twice the number of U.S. service members killed in World War One. That was when Spanish flu pandemic happened during World War One. Coronavirus case numbers are exploding across the country at the beginning of what is shaping up. It's a beginning. That's a very important. It's a beginning. Beginning of what is shaping up to be a typical winter of illness in America. Because remember, this is November. We have November, December, January, February, March, April, May to go. 7 months to go. 7 months of flu season to go. So that's why I'm saying 3 to 30 million Americans will die from now until then. Yeah, do you see why? Because now we have 1,500 deaths per day, but I'm predicting that it will go up to about 30,000 deaths per day. In several weeks, we'll have 30,000 Americans dying every day. That's coming. Look at the cases. We had 1 million cases last week in 1 week, 7 days. At 10% death rate, 100,000 of them will die, right? 100,000 distributed over 7 days, that's over 10,000 per day. But rate of infection is also increasing. So coronavirus cases are exploding across the country at the beginning of what's shaping up to be a difficult winter of illness in America. Quote, unfortunately, we are entering what I think will be the worst stretch that we have experienced so far. In the history of the United States, you mean, right? Says Caitlin Rivers, an epidemiologist at the Johns Hopkins Center for Health Security. Because health security is important because when citizens die in large numbers, foreign nations can invade. And as you know, I'm predicting that China will invade with their 50 million soldiers once we have like millions of citizens die. And they'll try to occupy our land with their 50 million soldiers they're going to bring over from China and colonize us. So that's one of my theories that are more long-term theory. But that could happen, in the next few years. I mean, they've been upgrading their weapons. Some of their weapons are superior to our weapons because we had 8 years of Obama when our weapons improvement didn't really go far, when China was aggressively pushing to upgrade all their weapons for 8 years of Obama years. So our weapons are becoming inferior to China's. 20 years ago, military experts predicted by 2020, Chinese weapons will be superior to US weapons. I think we still have weapons that are superior to China's, but most of US does not know, security industry does not know what kind of weapons China has, what they're hiding. So obviously when we have a war, we'll find out. So that is to say, China probably has strategic advantage militarily over us right now in terms of hardware in many areas. I think that's something that you could safely assume, given the fact that China has trillions of dollars and they have experts who are trained by the best American university, Caltech, MIT, Harvard, Georgetown, UCLA, UC San Francisco, UC Berkeley. They went back to China, and obviously they're brilliant scientists that we train, and they're building these weapons. We produce thousands of amazing mechanical engineers, electrical engineers, computer science engineers, and sent them back to China. I mean, they're Chinese nationals. Obviously, they came here, got education, went back to China. They're working on top secret weapons labs. So I'm sure they came up with weapons that are superior to ours because they got trained by us, by our best. So they have the education and the skills to build the weapons that are superior to our weapons right now. So, quote, unfortunately, we are entering what I think will be the worst stretch that we have experienced so far. says Caitlin Rivers, an epidemiologist at the Johns Hopkins Center for Health Security. You're seeing hotspots all across country and new highs for the number of cases and hospitalization. I said you gotta shut down every colleges in Virginia and require them to go 100% online. I had beseeched Governor Ralph Northam to shut down every college in Virginia, require them to go 100% online to reduce COVID-19 deaths. But Ralph Northam, Virginia's Democratic governor, did not listen. So now in Virginia, we have like 2,000 plus cases every day now. And we have, what, 6 to 8 months of COVID-19 exponential death growth to go. November, December, January, February, March, April, May, June. Governor Northam should have listened. History will exonerate me as a person who tried to save Virginia lives. And history will condemn Governor Ralph Northam as the one who increased Virginia's death by refusing to issue an executive order to require all Virginia colleges to go online. You'll see. Well, we're going to have spiking death in the next 3 weeks. I think we may even hit 10,000 deaths per day in 3 weeks or so. Let's see. You know, 3 4 weeks. Yeah, let's see. I think it could be as early as that, but certainly by like late December, January. Yeah, I mean, we may hit even 30,000 deaths by Christmas. That's possible because it's an exponential growth. They're spiking up like this. Especially if nurses die in large numbers, then obviously, 5% death can hit like 10% death, 15% death, 20% death in hospitals. Third article, with COVID-19 cases spiking, Philly needs to shut down completely. And this was in Philly Magazine by Ernest Owens. And it's why I say, I'm wearing my University of Pennsylvania face mask. And, in honor of this article, because I think Philadelphia is being mismanaged, and it's a shameful thing that University of Pennsylvania is not being a leader in saving lives, right? University of Pennsylvania president should be saying we need to shut down Philadelphia now to save lives. But have you heard University of Pennsylvania president say that? You have all these experts at University of Pennsylvania, and they have kept their mouths shut and haven't really tried to save lives, and it's a shame, and so it's a little embarrassing to be an alumnus of University of Pennsylvania when healthcare experts at University of Pennsylvania are refusing to practice ethical leadership to save lives, right? It's a shameful thing because Philadelphia is a city of 3 million people, and we could even have 1/3 of the population die because the city is not shutting down completely. It's a serious problem right now. University of Pennsylvania is not playing the role that it should be playing to shut down the country, the city, to protect lives. Georgetown University, where I did my master's in clinical nurse leader for 2 years as a full-time student from 2018 summer to 2020 summer, and I graduated in August 24th, 2020 with 24 others, so 25 of us graduated. Georgetown University completely shut down undergraduate classes, completely shut down all graduate level classes, MBA classes, nursing programs, school of foreign service programs, McCourt School of Government, all the PhD program courses, master's program courses were 100% online. That's what I call leadership. Obviously, I lobbied for 3 months to make sure Georgetown shuts down. So in a sense, the Georgetown shutting down and playing an important leadership role in this area is a testament to the leadership I have practiced. All the Georgetown University leaders know this. All the vice presidents, the president, department chairs, they know what I've done to try to shut Georgetown University down for 3 months before the new semester started. Even like 3 weeks from the semester start, Georgetown was going to bring like undergraduates onto campus, and I just like lobbied every day to make sure that doesn't happen because I don't want children to die. I mean, obviously, if you're over 18, you're not a child, but some students are 16, freshmen are 16, 17. And obviously, I don't want young people to die, young adults, 18-year-old and up, they're adults. I don't want young adults to die because we know from Florida virus that that is a mutated COVID-19 virus in June, largely in Florida. Now a lot of 20-year-olds can get COVID and many can die. Like hospitals in this area in Maryland, Washington, D.C., and Virginia are reporting 20-year-olds coming in with COVID and struggling to breathe. So their death rate is going to go up in the next few weeks. You're going to hear about it. 20-year-olds dying in Maryland, Virginia, Washington, D.C. hospitals. That's going to be big news in the next few weeks because they're now in the hospitals already, right? These 20-year-olds in Maryland, D.C., and Virginia. 20-year-olds are like young people are just, yeah, they can't breathe. So their death is coming, unfortunately. Hopefully, not, like we have more people living than dying, but you don't know. We don't know what's going to happen in the next few weeks because things are going to get worse and worse. So we may have more people die than live. We don't know. Only time will tell. And we're going to have nurses getting infected with COVID and dying. So I'm predicting that at least 12 nurses in every area hospital. So 12 nurses in Virginia Hospital Center will die before Christmas from COVID-19. 12 nurses in Fairfax Hospital will die from COVID-19 before Christmas. 12 nurses will die at Alexandria Hospital before Christmas. 12 nurses will die in Georgetown MedStar Hospital before Christmas. 12 nurses will die in George Washington University Hospital before Christmas. 12 nurses will die in Children's National Hospital before Christmas. 12 nurses will die in Sibley Hospital before Christmas. 12 nurses will die minimum at MedStar Washington Hospital Center before Christmas. 12 nurses minimum will die at Suburban Hospital in Maryland before Christmas. 12 nurses minimum will die in Arundel Hospital in Maryland. Yeah, minimum. I mean, probably far more than that. And we're talking about not just nurses who are 60 years old. We're talking about nurses who are 20 years old will die. So I want to do a cheer because I'm predicting that 5 out of 25 of us who graduated from Georgetown Master in Clinical Nurse Leader Program will die before Christmas. Obviously, I don't want any one of you to die because I love you guys. But this is a COVID-19 that's spreading wildly and killing 1,500 people right now. Probably will start killing 1,000 or 2,500 people by next week or more. So it's a rational decision. We got to deal with reality. We can't just like ignore the reality, right? So I'm going to do a cheer for you because I know some of you may die. Some of us, from COVID-19. Uh, you know, the COVID-19 class, CNL class of 2020. So CNL 2020, yay! We graduated from Georgetown. We can write on the tombstone, graduated from Georgetown as a Hoya, died as a Hoya 2020 with CNL RN next to our name. Although, I have to be honest, not everybody took the NCLEX RN exam yet among the 25 of us who graduated. And some people might not have passed the exam because, it's during COVID-19, we couldn't really study in the library, right? Kaplan classes we couldn't go to Kaplan in-person classes. So, like a lot of people could not take NCLEX classes in person. So some people learn best like in person. So, I wouldn't be surprised if few people failed NCLEX because they need a library to study in or, a cafe to study in, and they just didn't have that option. So they might have flunked because of that. Yeah, it's they're not gonna like advertise that, but our director of nursing probably gets the news that they passed or failed. So yeah, so yeah, it's a sad time right now. Yeah, so the article says Monday's new COVID-19 restrictions. So that was like 2 days ago, right? Which have the city banning indoor dining again and reclosing theaters, gyms, and indoor exercise.
Plenty, don't you? The smooth, creamy gelato in the clear jar. 5 indulgent layers and pumpkin pie.
I know you may get depressed and want to have an ice cream, but stop. Because you don't, we talk about COVID-19 like freshman 15. We can talk about COVID-19 15. You're gonna gain weight if you eat ice cream. So even if you're depressed, have an apple, have a strawberry, have a cherry, have a banana. Do not go to ice cream. You don't want to gain 15 pounds. And if you're single and you're not married yet, geez, you know how shallow guys are. Physical beauty is the most important thing for guys. That's like 99.9% of guys, whether they're really good Christians or they're not really good Christians, it doesn't matter. So you gotta keep your figure. If you're not married and you're like, younger than 26, I mean, geez, you have to make sure you're exercising every day at home. Get an exercise bike, treadmill, exercises at home. Don't gain weight while there's COVID-19 because you still have to get married and you have to be thin, keep up, your physical beauty. That's very, very important for guys. Guys are what they are. It is what it is. Guys are shallow and they fall in love because of their physical beauty. I mean, they'll lie to you and say, oh, I like your personality, blah, blah, blah. But they're lying. They actually fall in love with you because you're beautiful in their eyes. Yeah. As simple as that. Guys are like that. Guys are very shallow. They've been always shallow since the beginning of time. They'll always be shallow until the second coming of Jesus. That's not going to change. So you need to keep your weight down. Don't have that ice cream. Don't have that gelato. However tasty it may be. So I'm glad that I had an opportunity to come and share that because of background noise. Sometimes background noise is helpful, right? For understanding what's really important. Yeah. So let's go to Monday's new COVID-19 restrictions, which have the city banning indoor dining again. Of course, if you're inside eating in a restaurant, I mean, you're going to get COVID. I mean, aren't you surprised? Are you surprised that there's so many people getting COVID in Philadelphia right now? So they should have done that a long time ago. And we're closing theaters, gyms, and indoor exercise classes from November 20, that's like Friday, till the end of the year. But we're a long time coming. Yes, they should have done it a long time ago because right now, Philadelphia, Pennsylvania, state of Pennsylvania has over 4,000 infections per day sometimes. And that's happening because these were all open. They should have closed down, much earlier. So this mismanagement by city of Philadelphia, mismanagement by Pennsylvania. And as I said, University of Pennsylvania is not practicing the leadership that it should to save lives in the city of Philadelphia, in the state of Pennsylvania. It's a shameful thing because the University of Pennsylvania is one of the best medical centers in the world. And they should play more of a leadership role in saving lives, but it's not. And you don't hear anything coming out of Penn telling, close down this, close down that. They should be speaking more about saving lives in COVID-19 than other things, other kind of noise that don't matter. You see what I'm saying? You got to prioritize human life, and that's an important thing. Yeah, so I encourage every leader at University of Pennsylvania to prioritize saving lives in COVID-19 and not on anything else that really don't matter, really. I mean, what's more important, saving lives or, blah, 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 blah. You know what I'm saying? So we need to shut everything down in Philadelphia, and University of Pennsylvania needs to practice leadership in calling for shutting down everything in Philadelphia, all the schools in Philadelphia. You need to practice your leadership, and I'm sure other alumni of University of Pennsylvania agree with me that life is the most important thing. The University of Pennsylvania should prioritize saving lives in COVID-19. I'm sure 100,000 alumni around the world agree with me on that point. Yeah. So, yeah. So as cases rise exponentially, right? It's rising exponentially in Philadelphia, Pennsylvania. It makes sense that places where large numbers of people gather are facing new restrictions. But according to Ernest Owens, but this isn't enough. These restrictions, while tougher than recent ones, aren't nearly as aggressive as those in the spring. That's the point, right? Right now, the situation with COVID is far worse than in April 2020. But the restrictions in the city are not. Does that make logical sense? And we have 6 months of COVID-19 death to go. The flu season's COVID-19 death. November, December, January, February, March, April, May, June. More than 6 months. Um, yeah, as you know, I'm estimating that 3 million to 30 million Americans will die from now until June 2021. You see, I'm coughing. I'm coughing into my mask. But some people will go, they'll cough outside of their mask in a hospital elevator. And, the COVID-19 is airborne, so it'll be floating around. If they have COVID, somebody comes in, adjust their mask because they think they're all alone and catch COVID. Yeah, that's going to happen in every hospital. Yeah, so yeah, as you know, I started this show on April 2nd to save your life from COVID-19 and save your children's life. And I'm happy that I saved many of your lives because you followed my advice. So it's good that you did, and because you're still alive. And I'm glad that I saved many of your children's lives through this show as well, because you as a parent have seen this show and followed my instructions and guidance and recommendations. And obviously, I've worked hard for 3 months to close down all the public schools in Virginia's 8th District, Arlington, Alexandria, Falls Church, and Fairfax County. Even the Democrats wanted it open. Like Fairfax County Democratic County Board wanted to open Fairfax County Public Schools. Arlington County Democrats want to open Arlington County Public Schools. Falls Church City Public Schools, Democrats wanted to open those. Democrats in Alexandria City in Northern Virginia wanted to open its schools. I worked hard to close these schools down to save your lives. So you kind of owe me, I mean, let's be honest here. But obviously, my reward is that I saved your life and your children's lives. But you need to work hard too. You have to work with me to reduce the COVID-19 death in this area, because this is a hotspot area. Fairfax County is like #1 for COVID-19 cases and hospitalizes and death. And so, these Democrats, socialists, they have this tendency to make dumb decisions that cost people lives. Like Fairfax County Public Schools is trying to open their schools. Can you believe these Democrats? These complete idiots. These are COVID-19 spreads person to person. Why would you want to open schools? Doesn't make sense. Doesn't make any sense. But Fairfax County is basically Democratic, and they're trying to open their public schools. What's up with that? Do you see what I'm saying? This is why you should vote all the Democrats out of Virginia, because with Democrats in power, I mean, geez, death rates are going to spike. But anyway, I'll bring you more facts and figures to save your life and your children's life. Hopefully, these Democratic politicians will not try to push their ideological liberal progressivism, and centralize that over saving your lives. You know how these socialist communist types are. They're all about ideology. They don't care about people. They care about ideologies, right? These socialist, liberal, communist ideologies. And that's why Fairfax County Public Schools want to open. They don't care about your life. They care about ideologies. Yeah, but I care about your life. I want to save your life and your children's life from COVID-19 death. And that's what we have to focus on. And we have to call Fairfax County, county board members to ensure that they don't prioritize their liberal progressive ideology over saving people's lives from COVID-19 death, right? So let's focus on that. And I hope that you will join me in fighting for saving lives, and that you will hold the Democratic leaders in Arlington, Alexandria Falls Church, and Fairfax County accountable for rising COVID-19 death if they keep making decisions to jeopardize your life and your children's life, like by opening up Fairfax County Public Schools. And I understand that there are Democrats in Arlington County who want to open up Arlington Public Schools. Do you see what I'm saying? They're like ideology driven. They don't care about your life. They don't care about saving your life. And this is a serious problem because there are people dying. There are over 1,500 people dying right now in America every day. This is not a time to like push liberal progressive ideology and centralize that over saving human life. But this is what Democrats do. That's why I never joined the Democratic Party. That's why I hope that Joe Biden doesn't get sworn in January. I'm hoping that recounts will show that Joe Biden lost. So let's have the recounts in 5, 6 states, and let's see. Uh, Obviously, recount should be done under you know close observation to make sure that every vote is counted. That should be counted. So what we're looking for is accurate count, right? It's a democratic process, so that's what we're wanting, and let's see what the real results are. Yeah, that's a part of democracy, right? So anyway, I look forward to seeing you tomorrow, and I'll bring you facts and figures that are important. Some of you probably did not know that New York public schools are shutting down tomorrow, did you? And Fairfax County public schools want to open. Do you see how idiotic that is? Do you see how idiotic that is? Yeah. So yeah, call your Fairfax County board members. Call the superintendent in Fairfax County Public Schools. Call your principal. Call your teacher. Email them and tell them you want Fairfax County schools closed. Yeah, you want to reduce death in Fairfax County. Same with Arlington County. Call the superintendent. He's new in Arlington County. Call or email every Arlington County board member. Tell them that you don't want Arlington County public schools open because you don't want people to die of COVID. So you have to take charge. If you're a parent in Arlington County, if you're a parent in Fairfax County, to protect your family, protect your relatives, your neighbors and friends from COVID-19 death. You have to take action and contact Fairfax County Board, Arlington County Board, and tell them do not open public schools. That's something you have to do if you want to live. We have 6 to 8 months of flu season left, right? You got to do your part to reduce death in this area. You can be the hero who helps to reduce death in this area. So I hope that you will become the hero by calling on Arlington County board members, a superintendent of Arlington County Public Schools not to open schools, to keep the schools closed until June. Yeah, we have to do our part. God helps those who help themselves. Remember that. God helps those who help themselves. So you got to help yourself by contacting Arlington County Public Schools, principals, teachers, superintendent, Arlington County Public Schools, school board members, Arlington County leaders, and tell them you want the schools closed, right? You have to do your part. You have to be the hero of your children's lives, right? So I hope that you will do that today. As soon as you watch this show, you could email them. Yeah, and they could call them tomorrow morning. Yeah, so let's fight this together. Some of these leaders want to lead our county, Arlington County, Fairfax counties, our cities, Falls Church City, Alexandria City, in the direction of COVID-19 death. Let's not let them. So let's do our part in a democratic process to let our voice be heard. Close down Arlington public schools, keep them closed, keep Fairfax County Public Schools closed, keep Alexandria City Public Schools closed, keep Falls Church City Public Schools closed. You have to do your part. You can be the hero of Virginia 8th District. So let's all do our part. So I look forward to seeing you tomorrow. I hope that you will be well and that your children will be well too. Bye.